Good evening, everybody, and welcome to the latest COVID press conference. I'm delighted to be joined this evening by Brigadier Joe Fossey and by Jonathan Van Tam, the Deputy Chief Medical Officer. Across this country and around the world this evening, people are asking themselves the same question about where we've got to in our fight against COVID, and that is, does the progress towards a vaccine that's been announced today mean that we are at the beginning of the end of our troubles? So let me set out our assessment. The Pfizer-BioNTech vaccine has been tested on over 40,000 volunteers, and interim results suggest it is proving 90% effective at protecting people against the virus. But we haven't yet seen the full safety data, and these findings also need to be peer-reviewed. So we've cleared one significant hurdle, but there are several more to go before we know the vaccine can be used. What I can say is that if and when this vaccine is approved, we in this country will be ready to start using it. Earlier this year, the UK government ordered 40 million doses of the Pfizer vaccine, enough for about a third of the population, since you need 2 doses each. And that puts us towards the front of the international pack on a per capita basis. And I should add that we've ordered over 300 million doses from 5 other vaccine candidates as well. If the Pfizer vaccine passes all the rigorous safety checks and is proved to be effective, then we will begin a UK-wide NHS-led programme of vaccine distribution. We will decide the order in which people are offered the vaccination, taking account of recommendations from a group of scientific experts, the Joint Committee on Vaccination and Immunisation. And they're looking at a range of factors, including the different characteristics of different types of vaccines, to work out the most effective way to protect as many people as possible and save as many lives as we can. And we'll be setting out more detail about that in due course. But, and you know I'm going to say this, I must stress that these are very, very early days. We've talked for a long time, or I have, about the distant bugle of the scientific cavalry coming over the brow of the hill. I can tell you that tonight that toot of that bugle is louder, but it's still some way off. We absolutely cannot rely on this news as a solution, and the biggest mistake we could make now would be to slacken our resolve at a critical moment, because on Friday, Sage reported that the R is above 1 in England, though that doesn't take account of the current national restrictions. Alas, the death figures are rising, running at an average of 300 a day, sadly double where they were 24 days ago. The number of COVID patients in hospital has risen to, from just over 10,000 2 weeks ago to nearly 13,000 on the 5th of November, and we're heading towards the levels of the previous peak. Irrespective of whether there is a vaccine on the way or not, we must continue to do everything possible right now to bring the R down. And that's why we hope and believe that mass testing will help. And our first pilot began in Liverpool on Friday in partnership with Liverpool City Council. We've tested thousands of people there, but there's still a lot more to do. So please, if you are in Liverpool, get yourself along to a testing centre. There are 19 at the moment, with more still to come. And the more people get tested, the better we can protect that great city and drive the disease down in Liverpool. So do it for your friends, for your relatives, for your community. And I want to thank the fantastic support of the Army, of the people of Liverpool, Liverpool City Council, and we're now going further by sending out hundreds of thousands of rapid lateral flow tests to local authorities right across England, and also, of course, to the devolved administrations. We're working with universities to establish, as soon as possible, similar mass testing capacity for students up and down the country. But while we're making progress, This project is still in its infancy, and neither mass testing nor progress on vaccines, though they're both vital arrows in our epidemiological quiver. They're both part of the key parts of our fight against COVID. At the present time, they are no substitute for the national restrictions, the social distancing, hand hygiene, and all the rest. So now it's more important than ever to follow the rules. I know it's been a tough first weekend of these autumn restrictions, and I'm especially grateful to the Royal British Legion and all those who worked so hard to ensure that no virus would stop us yesterday from honouring the memory of those who gave their lives for our freedom. But we must get through this to the 2nd of December when these measures expire, and we plan to move forward with a tiered approach. Remember the basics then: hands, face, space, and follow the rules, and that's how together we can protect the NHS, save lives, and get the virus back in its box. That is what we will do.